Hi, I am Edwina Arceo, and I've known Dr. Contessa Salvador Alapag since she was still a student at AUF. I've also known her to have graduated summa cum laude of her batch. So I knew she was up for a really bright future and career. I've tried her services many years back when I had issues with dark pigmentation on my skin, and I had Cosmelan treatment administered by her. And then after that, I've seen great improvement, of course, but then through the years, I've again acquired pigmentation because of my activities. I really love the sun, so I love to travel. So I'm here right now because of my concerns on aging, sagging skin, and I still have those dark pigmentation. Do not forget to click the subscribe button to get more notifications from CSA.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. She's a school director, principal, educator, a teacher, a mentor, an inspiration, and a blessing to me and to a lot of people. Let's all welcome Ma'am Edwina Arceo.
Thank you.
Welcome po, Ma'am Edwina. In the past episodes, Ma'am Edwina, we were discussing about face reshaping, but our guests were in their early 20s, young ones. Because in that episode, we've mentioned that Asian face shape is more of a rounded shape and kind of short. Unlike the Caucasians, elongated and narrow. Then these are young people, early 20s. And we were discussing that it's something genetic. It is something they inherited. So what they were doing is just like highlighting those like beautiful features of the face and also balancing, because we have these rules of ratios and proportions for the face. We have this rule of 1-1-1. So we just wanted it proportion to the upper, middle, third. Now, for ages 50s, like me, 51, 50s, early 50s, late 50s, si Ma'am late
And
50.
beyond.
Yan, 50s and beyond. Or even like, Ma'am, they're saying aging starts at 25.
Wow.
Anyway.
No, but were we talking about Filipino?
Well,
Filipinas.
It's, yeah, in Philippines, okay, Filipinos look a lot younger as compared to Caucasians, right? Although, like, when we're having conferences, there's a mention of, like, even early, because I have patients 18 years old getting Botox.
Wow.
Probably the lifestyle.
That's too early.
They don't sleep early.
Because
Stress.
they look older.
Yes. So, yeah, lack of sleep and unhealthy lifestyle probably, or stress, or sleepless nights. Okay. So right now we have younger generation doing these kinds of treatment, but most of the time when it's younger, we're just like correcting and balancing parts of the face. Like if there's asymmetry, we just want it to be symmetrical. Now, when it comes to the process of the so-called aging, well, it's something natural. It's physiologic. It will happen to everybody. That's why when we become older, you notice like, grandma, I'm a grandma, I'm a grandmama. So what's happening is the shape of the face originally, we call it the triangle of youth, inverted triangle. Now it will be the opposite, pyramid of age.
Okay.
So everything goes down here. So it will become a heavy bottomed appearance here. So parang magiging square shape. So it's same as for men and women. Well, men, they want square shape. Parang okay lang for older men. However, the area here, the jawline, so you'll see jowls there, and then the jawline becomes, irregular. No more defined jawline. And then the upper neck becomes loose also. So parang yung lower face and the upper neck, it's like a single line already. So there's no more distinction to this one. Because of those molecular events happening inside the cells, happening inside our tissues. Well, this is physiologic. It will happen. Our DNA, it's programmed to like,
it's bound to happen.
Right.
Nature.
So like even like those chromosomes, it has some cap on the end, telomeres, that also will shorten as we age. So some of the chromosomes, and chromosomal diseases will happen if you have that or inherited something. So this is science. Still, we want to still give a natural result. And it's just like restoring what we used to have.
I like that.
Okay. So it's like aging backwards. Yeah, reverse aging na, reversal of aging. So what kind of treatment, what procedures, we will show you when we return. And we're back. So we'll be doing a non-surgical, non-invasive procedure for Ma'am Edwina. So we have here our device, the so-called Ulthera. So it's a kind of a medical device that uses ultrasonic energy, and it targets the tissues of the skin, epidermis, dermis, and then the subcutaneous fat, as well as the fibromuscular layer. And it will regenerate tissue collagen in the dermis layer. Plus also, some of my patients, ma'am, that have, like, for example, the jowl fats here, or even the under chin, some of the excess fats, it can also target it. So there's kind of like a reduction also, a benefit of reduction, because the face also should have this normal, like, content of all those soft tissues, face tissues. So this is a device, no needles with this one, so it's non-invasive. This is the US FDA approved device for skin lifting, tightening, firming, and also for even the eyelid lifting, this part here, if you have droopy eyelids, and even the neck region for neck tightening, skin tightening on the neck. Okay, so I'll be starting on the right side. Okay, ma'am. So, paturn po tayo sa left. Okay, so I have the 4.5mm transducer, and this device uses 3 types of transducers. Like we have a 1.5mm transducer. We also have a 3mm transducer. Tama kaya mo po? It's okay. Okay. So there's a normal sensation of like a tiny pricks and some heat sensation later on. Okay po. So we'll work on the jowl region here. So science is also amazing that this one is able to pass through from the skin surface going through the inner tissues. So it can stimulate those cells, ma'am, that will help in producing again your collagen and elastin. Actually, the collagen is the most abundant protein in our body. And collagen is in our joints, connective tissues, okay? And collagen is actually a macromolecule, a large protein. Then the second one is elastin. Okay. Even in the lungs, there's this elastin responsible for the elastic recoil of the lung tissues. Yun, ma'am, yung when we inhale, we exhale. So imagine how amazing those tissues are. Even in the skin, it has elastin. That's why when you pinch your skin, ma'am, it returns to when you release it, it returns to the original position. It's that elastin responsible for the elastic recoil. So parang rubber band. When you stretch and then release, it goes back to the original shape or original position. So we have those elastin protein tissues. So we want this device to kind of regenerate also those molecules inside. So what's the feeling, Ma'am Edwina?
Yeah, exactly. Parang pinching.
Pinching or tiny pricks. Or parang, feel mo parang may tiny needles. Yun. inside the orbit, the very internal orbit area, the eye area, the eye tissues. When I've done this for the first time, I had 300 shots. Usually, second week, I already noticed the effect of this one. Although the younger people, we also notice also a faster result, the young ones. And the young ones are more of the beautification, ma'am. And they are more of
they wanted firmer
skin. Plus, right now, they want the glass skin, 1.5. Korean skin, dewy skin, closed pores.
Glass skin is, how is it achieved?
Yeah, we have treatments working on the skin layer. Okay, so we have machines that we use. Right now, the RF microneedling. And then we have skin booster injections in the skin already, like hyaluronic. Apart from injections, apart from devices, machines, there are also like skin care. Yan, yung mga pahid-pahid na, yung cream, topicals. So it's also important.
Does that work?
They still work, ma'am, because they can penetrate. They have particles that will still penetrate epidermis, dermis layer. Okay, so like, ma'am, you look at the Koreans daily, 10 skincare steps.
I know,
So every day. Plus the creams, they have micronutrients. They have vitamins like vitamin C, glowing skin. Okay, and hyaluronics. This will hydrate the skin. Now, when we age, our skin becomes drier, dehydrated. It loses the capacity to trap water. That's why older skin tends to dry. So we need more of hydrating. We need more of like those moisturizers. And the turnover of the skin becomes slower as we age. That's why we need more exfoliation so that dead cells will not accumulate. So the more dead cells, the drier the skin, gives dull looking skin and aging skin.
Very...
Yeah. There you go. So we've done the right sidal therapy. Now, I mentioned a while ago that we have parts of the face that tend to droop, that tend to sag, okay? Like for example, on the upper third of the face, okay, our area of this tail of the brow here, corner of the eye, becomes saggy. So it's downturned. And then when you go into the mid-face, this mid-cheek groove, and then we call cheek ptosis here, because there's this, like here, orbital retaining ligament, this one, the zygomatic ligament here, they weaken. And then when you go on the lower third of the face, we have here the mandibular ligament here. The ligaments weaken over time. So they kind of like in an upright position, and as we age, they bend down. So since they bend down, the structures they're holding above, they also go down. So they bulge downwards, or they herniate downwards. So some of the fat tissues there, they go down. So we have a so-called technique, bold lift technique, making use of a natural substances. It's like a filler, ma'am, that we only place in those ligament areas. Okay, a certain point, like zygomatic ligament here, a portion of the aspect here, like we have a temporal septum here. We want support, and also support here, okay, and also support here, and support here. So I'll be working on the zygomatic ligament here. So we have the retaining ligament, zygomatic cutaneous ligament. Okay, we'll work on this part here. Maliit lang po, tiny pricks lang. And then a prick here. Ayan, ma'am. Okay lang? Okay, so I'll push a 0.1 ml of my substance here. And the goal is a so-called cheek lift. So if we don't want a saggy mid-face, and then just one here. So we have the zygomatic retaining ligament here. Just a tiny prick, ma'am. There you go. And then I'll just aspirate, and then a 0.1 there. And I notice ma'am also has a deep nasolabial fold, the one here. You're still good, ma'am? Okay po, nakakadalawa na. And then a tiny lang po here, a third one. Okay. Just same thing po, same technique. Inhale, exhale lang po. Medyo onto the bone. Ayan, and a 0.1 again there. And then I'll be proceeding to the so-called here, the inferior aspect of that mandibular retaining ligament there. Okay, onto the bone again, just to give support po, marionette. Ayun, bone na kaagad. So, a little 0.1. And then because we have this marionette fold, or we call it labiomandibular fold, we can check on the so-called Ricketts E-line. Ayan na. Actually, we also, in our field, we follow certain mathematical formula actually, ma'am. We also have something that we follow like lines, proportions, and ratios. So, ma'am, a little bit of a support here at the so-called symphysis menti, chin apex, listen tech, and tiny prick na lang po. And my final touch will be on the upper third of the face to improve those. Meron na tayong tinatawag na mga static lines. Okay, there you go. Done on the right. How was that? Tolerable lang po, no? And then, ma'am, we have once. We have the forehead wrinkle. The others are calling this worry lines. So the worry line or tiger line. We soften with baby dose of your relaxing Botox. Because what's happening is muscles contract. Pag laging galit na galit, ma'am, pag laging ito, ganun, yan po. So it's causing a tear in the skin collagen in the dermis and leaving a static line. A dent already. It's what we call baby dose that I myself, ma'am, inject on my face. So I don't develop this tiger line or worry line, sabi nila. But we don't worry. That's po. Some common terms. Okay, ma'am, I'll just pinch. This is for serous. Little bit. And the right corrugator. And the left corrugator. And then I'll just relax yung frontalis para po you don't develop the deep line here. And then to also help lift your upper eyelid, just a tiny dose, and a tiny dose. So there you go, ma'am. We've done the right side.
Wow.
What's the feeling po? Daming tusok.
Oo. Tolerable.
Yan po. So, okay, let's proceed to the left side. We have done combination procedures, Ulthera, the Radiesse Bold lift, and our micro Xeomin will show the result to Ma'am Edwina when CSA Medical Aesthetics returns. And so let's show the result to Ma'am Edwina. And Ma'am Edwina, here's our mirror po. Yan, you can check.
Wow!
So, it's just like a, you know, a simple method that we've done, the Ulthera, and then just a bold lift technique. Like, I didn't really use the full bold lift technique. There were areas that I skipped, okay? Because it's Mom's first time to receive an injection like this, and some micro doses of our Xeomin. Just a simple, a basic technique, starter treatment for Ma'am. Actually, I'm still recommending her like another treatment for this one because, you know, upper third, middle third, lower third, we see those signs of the, you know, the aging signs, okay? So on the upper third, actually, I was checking on the profile of the forehead. we need some forehead projection because we have volume loss here, a sunken area here. And then when you go to the mid-face, okay, so the droopy eyelid and also the under eye area and then the mid-cheek, then we still want to improve on the lower third and further on the upper neck. So right now, Ma'am Edwina, how was the experience po?
The pain is tolerable. Yeah, good.
Rest po. So these are procedures, of course, like the pricks from, for example, the Ulthera, you'll sense it. There are areas that it's really uncomfortable, especially bony areas, okay, or thin areas. You feel those the sharpness of the pricks from the Ulthera device, or Ma'am Edwina described it as like having a dental treatment, or the others were saying para kung nangilo. Some areas where some parts will be like that. Some of my patients were saying, no, I didn't feel anything. Some patients will say, oh, it's really painful. So we really have different threshold for pain. There you go. Then we did also the bold lift technique using the Radiesse, the calcium hydroxyl apatite. This is a semi-permanent type of a filler. And it's for like supporting those ligaments that went down, the weakened ligaments. And also we did microdose of our Xeomin just to improve the upper third, remove wrinkles and lines, get rid of this glabellar lines there, and also the crow's feet there. Ma'am, thank you so much po.
Thank you.
For believing in us and trusting us. Okay,
CSA.
so yes po. So these are non-surgical methods. They were scientifically studied and clinically proven safe, and like a lot of treatments were done worldwide. Okay, so this is still science.
So there'll
okay?
be more.
Actually, yes, ma'am. So this is a treatment, okay, that gradually you'll still see improvements. And this is like a natural process happening inside. And as I've mentioned, the Ulthera, like 4th week, 8th week, 12th week, you'll still see improvement. Because the collagenesis, it's a process. Like on the 3rd week, you're starting to see new collagen being formed. So it's working inside, but the effects are seen on the outside. Okay, so we have also the calcium hydroxyl apatite, another collagen stimulator, also a filler, a volumizer, okay, something that will also regenerate tissues inside. And the microdose of our botulinum toxin just to relax muscles. Some patients of ours, we use it for like those with spasms, okay, or those with headaches, or those with migraines. We also use those micro botulinum toxin for therapeutic uses, not only for cosmetics. So this is science, this is medicine, and based on a lot of scientific clinical studies. And of course, what's important is FDA approved. Okay, plus your physician,
and yes,
your injector.
Exactly.
We really, advise everybody, because nowadays we've been seeing a lot of complications from injections like this. So just make sure that your injector is authorized, qualified to perform these procedures, because there are also like, adverse effects if it's done incorrectly. Okay, yun lang po. So thank you so much. If you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. And please do watch our other videos at our YouTube channel, Contessa Salvador. So thank you, Ma'am Edwina. See you po sa follow-up. God bless po. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.